Multidynamic International Health Seminar. You forfeited all you need to do this evening, this night, to see that you're present, to acquire this knowledge that has to do with two health challenges that have been ravaging the entire human race. And what are those health challenges? Number one is prostate for the male folks. Prostate has always been a nightmare for the male folks. Then, on the other hand, we have fibroids. Fibroid has also been a nightmare for the female folks. No wonder today we want to deal with these two health issues, topics that are very, very timely, so that we can have the knowledge of it properly and see what we have in EMD, which is Ever Healthy Multidynamic International Limited, that deals on Indian Ayurvedic curative medicines that we need to use when such health challenges, either the prostate or the uterus or the fibroids, comes into play, becomes a health issue. Well, ladies and gentlemen, you all know health, they say, is wealth. There's also this adage that says, ladies first. Ladies first. Will Dr. Britishman adhere to that principle? Yes, yes, yes. Ladies first. Why do I say so? I will start with the health issue that deals on fibroid. 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 Yes. Okay. Sorry. I think my host is telling me prostate. Like you can see on the screen. You can see on the screen. It's all right. It's all right. It's all right. Ladies and gentlemen, I will commence with the prostate. This time around is going to be gentlemen first or men first. All right. So prostate has always been, right from time immemorial, a nightmare to the male folks. Very dangerous health issue, very dangerous disease. In fact, this prostate has sent many men to an untimely death. This evening, we are going to know firsthand as a man what prostate is. What are the functions or what work does a prostate does for you as a man? We're going to find out this evening. We're also going to discuss about the anatomy/location of the prostate gland, because this prostate gland is evident in every male folks. We're also going to discuss conditions and disorders of the prostate. We're going to see various types of conditions, disorders or health challenges of the prostate, and how are prostate problems diagnosed. What diagnosis will you carry out to know your prostate gland status? Very, very important. Very, very important. And finally, we are going to see what we have in Ever Healthy Multidynamic International that deals on Indian Ayurvedic curative medicines, that you will make a product of your product to take good care or stabilize the range of your prostate gland as a man. So, what is prostate? The prostate is a small, firm, walnut-sized muscular gland that helps make up the male reproductive system. A small, firm, walnut size. I believe you all, gentlemen and ladies present this evening, you know what walnut is. Walnut is a black nut under the family of nuts. It's round. When you open that black shell, you will see the white or cream nuts inside. At the middle, you see a leaf. That middle leaf in it, which is also white, is the main ingredient of the walnut. Walnut is very, very good for the heart because it contains fiber. So that size of walnut is exactly the size of the prostate gland. Yes, that is why we say the prostate is a small, firm walnut-sized muscular gland that helps make up the male reproductive system. That is the prostate gland for you. As you can see on the screen, there you can see the prostate gland. You can see the prostate gland where it is written there. This one says enlarged prostate gland, means that it has enlarged, it has inflamed, it has issue. Okay, so this is where the prostate gland is situated. All right, just in a simple terms, where the two testes and the scrotum are, close to your rectum. All right, so the prostate gland helps make up the male reproductive system. It surrounds parts of your urethra as a man. Okay, the urethra, gentlemen, is that pipe in between your penis, in between your manhood. At the tip of your manhood, urine comes up. That urine that comes out passes through your urethra. That is what the urethra is. That pipe where urine comes out when you urinate as a man. That is why we say that the prostate gland surrounds part of your urethra as a man. Urethra, on the other hand, is that pipe in your penis or reproductive organ that pee or urine flows out, just like I've explained. The prostate creates fluids that help make up semen. Semen is the fluid that carries sperm during ejaculation. It leaves your body through your urethra, which is the same pipe I talked about where pee comes out, usually after an orgasm. The prostate gland is situated below your bladder, in front of your rectum. The prostate gland is made up of both connective and glandular tissues. Remember before now, I've taught you, lovely ladies and gentlemen, that collections of cells makes up a tissue. Collections of tissues makes up an organ. And collections of organs makes up the system. In effect, collections of cells is the reason why the prostate gland is here. They are made up of what? Connective and glandular tissues. If you all really, like I said, I've taught this before now. So the prostate gland naturally gets bigger as you get older, meaning as you're aging, your prostate gland will begin to inflame, will begin to get bigger, will begin to enlarge. As you're aging, it's a natural phenomenon. Okay? As you're getting older. But other conditions that affect it include what? Prostatitis. Prostatitis is what we call erectile dysfunction. Prostatitis is the major reason why the male folks experience erectile dysfunction. Major cause of why the male folks experience erectile dysfunction. All right. So, having known this about the prostate gland, what are the functions of the prostate gland? What does prostate gland does for you as a man? What does it do for me as a man? Pay attention. Functions of the prostate. In other words, what does the prostate do for you as a man? Your prostate gland makes extra fluid in your semen. One of the works, extra fluid in your semen. The fluid contains, this fluid from the prostate gland contains enzymes, zinc, and citric acid. No wonder the male folks are always encouraged to eat fruit, eat food, minerals that contain zinc, so that your prostate gland will not enlarge, will not inflame, will not get bigger than the normal size. Citric acid can be gotten from oranges, lemon, lime. All right? So this prostate semen contains enzymes, zinc, and citric acid. These components help nourish sperm cells and lubricate your urethra, which is the pipe where sperm and urine leaves your manhood. Muscles in your prostate also help push semen into and through your urethra when you have orgasm or experience orgasm. When we talk about orgasm, this time around, we are talking about legally married husband and wife. Yes, they are the ones that legally, naturally should experience orgasm. These are the major works carried out by your prostate gland. Now the question is, do women have a prostate? I know some now will be saying, Dr. Britishman is asking a funny question. Do women have a prostate? The answer is no. Females don't have prostate, but they have skinless glands. Medical experts believe they release fluid that helps with peeing, cleanliness, and lubrication during sex. They may also release fluid during orgasm, like males. No wonder some people refer to skinless glands as the female prostate, but not like the prostate of the male folks. Have that at the back of your mind. That having been said, anatomy/location of the prostate. You can see on the screen, your prostate is located below your urinary bladder and in front of your rectum. Let me shed more light on the rectum. Rectum is where, when you defecate, it comes at that anus, that round side of the anus. When you defecate, that cycle there is the rectum. Okay, so that you get it clearly. All right, so your prostate is located below your urinary bladder and in front of your rectum. All right, I've explained what it looks like. I said it's like the size of a walnut. In fact, it weighs about 1 ounce. 1 ounce is like 30 grams, which is as heavy as 5 US quarters. As you age, your prostate usually gets larger. It can grow to the size of a lemon. And that is when one is aging. Take note of that. Your prostate has 5 lobes or sections. Yes, 5 lobes or sections. The first, you can see on the screen, the anterior and the front, which has to do with the front of the prostate. Then the posterior, which has to do with the back. Third, the lateral, which is one on each side. Then fourth, the median. Remember in school, we were told that median has to do with the middle. So median here is in the middle of the prostate. All right, so both the connective and glandular tissues make up its structure. Prostatic fascia covers your prostate. Prostatic fascia is like a hot dog casing. It's a sheet of thin, stretchy connective tissue that holds your prostate in place to make sure it is there. It doesn't move or shift boundaries in its right position or location. What are the conditions and disorders of the prostate? What will play out for the prostate to begin to experience disorders, health disorders, or problem or health challenges? What are the most conditions and disorders that affect the prostate? Common conditions that can affect your prostate include 1, what we call BPH, that is benign prostatic hyperplasia. In a short term or short form, you say BPH. Benign is non-cancerous tumor. When you say this tumor is benign tumor, what it simply means is that it is non-cancerous. It doesn't have traces of cancer. That is benign. So one of the health issues of the prostate gland is benign prostatic hyperplasia. Pay attention, meaning that this health issue of the prostate gland is not cancerous. So PBH causes your prostate to get larger. It can squish your urethra and then cause it to become narrow. You see now, since we term it to be benign prostatic hyperplasia, that is when the prostate gland have enlarged. It has inflamed beyond the normal size. And when that occurs, it makes the urethra to do what? To become narrow. So that when you're now peeing, you see that peeing won't be coming out, we won't flow out freely the way it's supposed to. It's just like you're washing a car, you have this pipe. You're washing a car, you have this pipe. There's a way you place your thumb on the pipe. You see, there's a way the water will begin to come out forcefully. There's a way to be pushing down your thumb in front of that pipe while washing a car. That is what benign prostatic hyperplasia does to the prostate gland. Sorry. Gentlemen, I hope I'm being heard. Hello? Hello?
Yes, sir. Yes, sir. You're being.
All right. Thank you so much.
We're hearing you.
All right. Thank you so much. So that is the benign prostatic hyperplasia, one of the health challenges that the prostate gland experiences as a man. It makes the prostate have become larger. It has inflamed beyond the normal size. And when that occurs, it narrows your urethra. Like I said earlier, the urethra is where urine, pee, sperm comes out. It narrows it, making it difficult for you to urinate. Why in the four corners of medical school, we were taught that at age 40, that is when a man is entitled to go for diagnosis to ascertain his prostate gland status. But ladies and gentlemen, change, they say, is constant. Change, they say, is inevitable. Change, they say, is dynamic. Now, as we speak, ladies and gentlemen, or the male folks, so to speak, at age 25, it's no longer 40. At age 25, a man of age 25 can experience benign prostatic hyperplasia, enlargement of the prostate gland at age 25, no longer 40. Is it all about prostate enlargement? That is all narrowing of the urethra? No. No. It can also cause blockages in your urethra. Think of it like a king in a garden horse. It can cause problems with peeing and ejaculating. You can imagine blocking the urethra, this benign prostatic hyperplasia. When the urethra is blocked and this urge to pee comes into play, what happens? For pee to come out from the urethra becomes challenging, becomes a problem, becomes difficult. In fact, it becomes painful. And when that occurs, as a man, you begin to experience waist pain, lower abdominal pain, because already this pee is supposed to leave the bladder through the urethra. But now, because you're having benign prostatic hyperplasia, BPH, the urination becomes difficult, becomes a problem, becomes challenging. You see, so that is one out of the prostatic gland prostate gland issue. That is benign prostatic hyperplasia. The next that goes with it is what we call inflammation. In medical terminology, we call it prostatitis. That is inflammation of the prostate gland, quite different from benign prostatic hyperplasia. It's quite different. It's not the same thing. This one now is inflammation, the second health issue, inflammation, which is we call medically prostatitis. Prostatitis is the major cause of erectile dysfunction in the male folks. This causes the tissue in and around your prostate to become swollen and tender. It's the most common urinary system issue in males younger than 50 years. It's the third most common urinary system issue in males older than 50 years. You can imagine. So begin to use your thumb to count your teeth now. Are you 40 years of age? Are you 50 years of age? Are you above 50 years of age? Please, after this health discourse, it's important you go for diagnosis to see if you're having prostatitis or inflammation of the prostate gland as a man. The third one, another health issue of the prostate gland, is prostate cancer. Now it has become cancerous. It's no longer benign, non-cancerous. This time around, it is what we call malignant. It has become cancerous. It has become what? Cancerous, malignant. Because they are different between benign and malignant. Malignant is cancerous, while benign is non-cancerous. So the prostate gland now have become cancerous, prostate cancer. And that is why it is called prostate cancer. Prostate cancer is the second most common type of cancer that affects the male folks. You may not have any symptoms during the early stages, but as it progresses, it may affect how you pee and cause pain in the area. What are the symptoms of a bad prostate? Now take note of the symptoms. Now, before I take the symptoms, ladies and gentlemen, or gentlemen, when we said this prostate have turned out to be from benign prostatic hyperplasia, which is BPH, to inflammation and then prostate cancer. Ladies and gentlemen, we have different stages, which I also want to share with you, lovely audience. Different stages. Prostate cancer has stage 1, it has stage 2, it has stage 3, and it has stage 4, which is the peak and advanced stage. Since it has 4 stages, outside benign prostatic hyperplasia, outside inflammation of the prostate gland, prostate cancer. You see why Dr. Britishman from time to time emphasizes on check and balance concerning our health. From time to time, we go for routine medical checkup. Because if you're used to going for routine medical checkup, knowing fully well that health is well, definitely you will be able to know as a man when this prostate cancer is in stage 1, when it is in stage 2, when it is in stage 3, before it gets to stage 4, which is the advanced peak stage of all forms of cancers. Now in stage 1, look at what happens when the prostate cancer is in stage 1. Look at what happens. The cancer is very small and stays inside the prostate gland. That is stage 1. Let me reiterate it again. In stage 1 of the prostate cancer, the cancer is very small and stays inside the prostate gland. Stage 1. What about stage 2? The cancer is still inside the prostate, but is larger or more likely to grow. Already, ordinary mathematics or arithmetics, those days, you know that there's a sharp difference between 1 and 2. It's not the same thing. So you can see that in stage 2 now, though the cancer is still inside, but now it's larger. The cancerous cells are larger. They've multiplied. More likely to grow beyond that if nothing is done about it in terms of treatment. What about stage 3? The cancer has grown outside the prostate gland into nearby tissues. It has left the prostate gland now, begin to spread, especially looking for lymphatic organs to affect the lungs, the neck, the loin. Yes, these are lymphatic organs because now it has left the cancer has spread, grow beyond what is normal. It's looking for where to now look for home, space, accommodation. Yes, that is stage 3. Stage 4, the cancer has spread to nearby lymph node. That is the lymphatic organ, other parts of the body like the bones, the neck, the lungs, and other parts of the body. You see, that is the advanced and peak stage of cancer. All forms of cancer, apart from prostate cancer. You see why it is good to do check and balances from time to time as a man, because let the truth be told, this prostate health issue has become a serious nightmare for the male folks. That is the bitter truth. They say, so that is the stages we have when it has turned to be prostate cancer. 4 stages. Stage 1, stage 2, stage 3, stage 4. The symptoms of a bad prostate is dependent on the cause. But in general, prostate conditions usually cause conditions like blood in your semen. When you see blood in your semen, it simply shows that there's issue with your prostate. Medically, blood in your semen, we call it hematospermia. Hematospermia. That is the medical terminology when there's blood in your semen. Hematospermia, meaning that there's blood in your semen. It's not normal for every healthy man whose prostate gland is healthy. When you see blood in your semen, simply means that your prostate gland has issue as a man. Number 2 symptom, blood in your pee. Is it normal for a man who is peeing or urinating to see blood in his urine or pee? Wrong. It's unhealthy, ladies and gentlemen. There's a problem. It shows that this man prostate gland has issue. And medically we call it hematuria. Hematuria is when there's blood in your pee or urine. Difficulty starting to pee or urinating, another third symptom. This time around I'm discussing the symptoms. First is blood in your semen, blood in your pee, difficulty starting to pee. In fact, how it occurs is that you'll be having this urge of peeing. The urge will be so high. You see yourself rushing to the restroom, only to get to the restroom to remove your zip. Oh, this pee, thinking that you're going to pee on your panty. Only for you to get to the restroom, unzipping your trouser yourself, bringing out your pennies for urine to come out, going by the urge, strong urge to urinate. But it's not coming out. There's difficulty coming out. Yes, another third symptom. Are you experiencing it as a man? Begin to use your tongue to count your teeth. Gentlemen in the building, in the seminar this evening, begin to cross-check self-appraisal as a man. These are the symptoms. Now, dribbling, another fourth symptom, dribbling when peeing. Dribbling when peeing, when you pee or urinate. Remember, when you talk about best dribblers in the football today world, Messi will come to mind, to the fore. Ronaldo of Portugal will also come to the fore. Messi of Argentina will come to the fore. Because these are the two best dribblers we have now. Lamar of Spain have also joined. So now your pee is dribbling you. How do I mean by that? Dribbling when you pee, when you urinate as a man. You can imagine that strong urge. When you bring out your penis to pee, the pee comes out, then hold back again, and you begin to wonder what's going on. The urge is still strong for you to pee. It drops, break, comes out again, break. That is dribbling. Your pee is dribbling you. Yeah, it has turned out to be Messi or Ronaldo. Dribbling. You see? Meanwhile, this pee is supposed to come out, boom. But it's dribbling. You pee, it breaks. You pee, it breaks. Meanwhile, the bladder is filled. It doesn't come out forcefully the way it's supposed to at once. That is dribbling in pee. Another symptom, loss of bladder control. That is urinary incontinence. Loss of bladder control, urinary incontinence. Or bowel control. How do I mean loss of bladder control? The pee are not really coming out from the bladder the way it's supposed to. Meanwhile, the bladder is filled. And the pee wants to come out, but because there is prostate issue, the prostate gland has issue, the pee is not really coming out. And when that happens, lower abdominal pain creeps in for you as a man. At times too, you begin to have pain in the scrotum. Before you know it, it comes to the waist. Before you know it, your lap, your legs, stretch down to the legs. These are the symptoms. So as men in the building, in the house this evening, let's begin to scrutinize ourselves. Whether we are experiencing any of these symptoms at this point in time of our life or at this age we are as full-grown adults. Another symptom, needing to get up a few times to pee while you're sleeping. Medically, we call it nocturia. You get up oftentimes to pee while you're sleeping. Yeah, frequent urination. You know, before now, when we discussed diabetes, I think sometime last month or so, we talked about diabetes, and we said one of the symptoms or signs or symptoms of diabetes is frequent urination. So, ladies and gentlemen, you can see that getting up at night to urinate frequently as a man is a sign that your prostate gland needs attention. Have that at the back of your mind. Another symptom, pain during sexual intercourse. Are you a man? Are you legally married? Do you have pain while having sexual intercourse with your legally married wife? If you do, your prostate gland has issue because it's not supposed to be so naturally. Pain during sexual intercourse. Another symptom, pain in your genitals. Are you having pain in your genitals? Is there any kind of pain even in your testicles? Another symptom, pain while peeing. Do you experience pain while peeing as a man? Or after ejaculation or orgasm as a legally married man, you experience pain. A thing that's supposed to be a thing of joy, a thing of happiness, but it turned out to be pain, pain, pain. Go for diagnosis for your prostate gland. There's an issue, there's a problem, there's an underlying health issue there. You're not supposed to be having this pain. Sudden urges to pee. Suddenly, it didn't show you sign, just suddenly pee, you just want to pee. Suddenly, just like that, no sign that, you're having that urge to pee. Urinary, we call it urinary urgency. It's a sign that your prostate gland has issue. Trouble getting and keeping an erection. As a man listening to this health talk this evening, are you having at 4 a.m. or 5 a.m.? Does your penis not erect? It doesn't erect between 4 a.m. to 5 a.m.? Are you having issue with that? If you're having issue with that as a man, you're experiencing erectile dysfunction. There's prostatitis. You have prostatitis. Your prostate gland has issue. That is the truth. If at 4 a.m., 5 a.m. as a man, you don't have that early morning erection, there's a problem with your prostate gland. So, ladies and gentlemen, these are most of the symptoms, signs and symptoms of prostate gland issue. How are prostate problems diagnosed? Number one, now for diagnosis, before I take that, pay attention. As long as you're a man, age 25 and above, you must go for prostate diagnosis twice in a year, once every 6 months. One of the tests, we call it PSA, which is prostate-specific antigen test. They will take your blood sample and carry out that test. The laboratories or healthcare provider will tell you to sit and wait for some hours, or better still, go home, later you come back and pick up your PSA test result. Outside the PSA, there are other diagnoses. Prostate exam. A prostate exam includes a digital rectal exam. Your healthcare provider inserts a gloved, lubricated finger into your rectum to feel your prostate. Yes, a healthcare provider. All he needs to do is that you go to him, you walk up to him, he puts on a glove, then dip his hand inside your rectum, because from the rectum, you can feel your prostate gland, that walnut-sized prostate gland. You can feel it. When he does that, he will ascertain from the feelings with his fingers, with hand glove on him, on the hands, to know, it has grown beyond the walnut size it's supposed to be. That is one of the diagnoses. Then I've made mention of the PSA, which is prostate-specific antigen test. And this one is also important to ascertain whether this prostate has turned out to be either PBH, that is benign prostatic hyperplasia, or it has become prostate cancer proper. And like I said earlier, in terms of prostate cancer, it has 4 stages, stage 1, 2, 3, and 4. Another test, T-test, which we call urinalysis. You can go for urinalysis test. It will also provide the issue you have with your prostate gland, or better still, that urinalysis test will show, this prostate gland has been infected by infection. It could be STDs, it could be STI, it could be bacteria or fungal infection. the urinalysis test result will show. So these are three major diagnoses you need to go for as a man to know the status of your prostate gland. Now, how can prostate health be maintained? How can you maintain your prostate health as a man? One, getting regular prostate screenings, which has to do with diagnosis. I think I've shed light on that, the three major diagnoses you should go for. Getting regular prostate screenings. All right? Most males should start screening at age 25. Yes. Getting it regularly to maintain prostate healthiness. Number two, regular physical activity or exercise. When we say regular physical activity, we are not saying that you should go to the gym. Maybe you're a man age 60, 50, 65, 70. Dr. Britishman is not saying that you should go to the gym and begin to carry iron. No, that's not what I'm saying. Are you aware that as an adult, as a man, taking a walk is a very good physical activity? You can take a walk. It could be 30 minutes walk. Excellent. It could be 1 hour, depending on your stamina, your energy, and your strength. So leave gym out of it. I'm not saying you should begin to go and do press up. That's not what Dr. Britishman is saying. When I say physical, you're getting yourself in regular physical activity. Now let me begin to do press up. Who knows? Maybe doing press up now, the person will collapse. Possibly he doesn't know that he's even hypertensive. The blood pressure is high. On the verge of doing press up, the person will slump because the blood pressure is high. And he's unaware of that. He doesn't know that he has high blood pressure. So it's just a light exercise. Take a walk. Little jog, just light jog, workout, just light workout. I'm not saying tedious or strenuous one. No, that's not what I'm saying. So regular physical activity, very good. Okay. What other? Eating healthy foods every day to maintain the healthiness of your prostate gland. Eating healthy foods every day. This is the area where lifestyle comes into play. Eating the daily recommended amount of fruit, veggies, and healthy protein may promote prostate health. You see, let me shed more light on this. You see, before now, some of us believe that, semovita, it's rich man's food. Many of us are moved to eat semovita. Are you aware, ladies and gentlemen, that the glycemic index of semovita is very high? Semovita, check, Google the glycemic index. You'll see what I'm talking about. Meaning that as an adult, you don't need semovita because the glycemic index is high. That is where eating habit comes into play. Healthy foods, you don't need it. What about wheat? You will hear the doctors recommend even for diabetic patients, eat wheat. Ladies and gentlemen, wheat contains high sugar. I can't imagine myself recommending wheat for my diabetic client or patient. I wouldn't do that. Are you aware? But some of us will be eating it and we feel that we are eating healthy. What about intake of alcoholic beverages? Some even mix. I've seen the Gen Z generation of this of this generation. You see them mix codeine inside alcoholic beverages because they want to get high. They want to feel high. They don't know that they are destroying their prostate gland. Even tramadol, shisha, name it, monkey tail, ice, colos. These are drug abuse, hard drugs. If you engage yourself in such lifestyle, it will knock your prostate gland. You're going to have prostate issue as a man. So we must be mindful of our lifestyle, even much consumption of alcoholic beverages. Here in Lagos, Nigeria, they will tell you that a wolf, they run belly. A friend takes you out and you feel that, it's not your money. Bring more. Madam, serve them. Waiter, please, more bottles on the table. Much consumption of alcoholic beverage contains toxic And this toxic will hit your prostate gland. Because consuming much alcoholic beverages, you're overworking your liver. Even the kidney, in terms of flushing toxins from the body, the liver will not have the strength to flush everything at the same time. The kidney will not have what it takes to flush everything at the same time. You'll be working your liver and your kidneys. And remember, the prostate gland, the bladder and kidney works hand in hand. What is more, you must quit tobacco smoking if you're in it as a man. If you really want to maintain a healthy prostate, quit tobacco smoking. Stop drug abuse. Stop much intake of alcoholic beverages. We know, like I do teach from time to time, alcohol serves as a catalyst because it speeds up metabolism in our body system. No wonder all the foods we eat contains alcohol. But the abuse of it, misuse of it, is bad. It's not healthy at all. So you must quit smoking if you really want to maintain a healthy prostate. If you're a man listening to me this evening. All right, so what have we discussed so far? In summary, ladies and gentlemen, prostate, every man is created with prostate gland. As long as you're a man, every man is born with it. Okay, and the purpose of prostate is to create fluids in your semen and force semen through your urethra. When you ejaculate, your prostate will likely get larger as you age, yes, okay, which is normal, but prostate cancer is the second most common that affects the male folks. All right, no wonder when a man has prostate cancer, the surgeon doctor will tell the man and the relatives. Because oftentimes when it gets to stage 4, which is the peak and advanced stage, the family members will take the man to the hospital for surgery. And the surgeon doctor will tell the man, before his relative, they must sign that legal medical document before he will perform the surgery of the prostate that is that is cancerous. 50-50, we tell them 50-50. This man going into that theater that I'm going to operate on is 50-50 chance. He may go from there or he may come out from there. But history have shown medically that even when they come out in a few years or in a short while, they die, they still die. You see why it's important we maintain a healthy prostate as a man, healthy living, and be mindful of our lifestyles? Yes, they will tell the man that's going for surgery, even the relative, they'll sign a legal document, medical document. It's 50-50. Doctors don't hesitate to tell their patient that when it has to do with prostate surgery because it's cancerous. And after the prostate cancer, what happens? The man will end up wearing catheter. Yes, catheter. Artificial pipe connected to the urethra. The urine won't be coming out from the urethra again because that one has been condemned because of the surgery. He will now temporarily put on wearing catheter, where urine will be coming out. Artificial. That catheter is artificial. And it's very painful. Ask any man who is alive who have undergone prostate cancer surgery. He will tell you how painful, excruciating the pain is. In fact, you won't even allow your enemy to have that kind of health challenge. So, it's also imperative for us to know as a man, the normal prostate range that we should be looking at as a man when you go for that PSA test. However, the range all depends on your age as a man. Usually from age 40 to 49, the range is from 2.5 ng/ml. While from 50 to 59, the normal range is usually from 3.5 ng/ml. While from 60 years to 69, the range is from 4.5 ng/ml. While 70 and above is 6.5 ng/ml. However, medically, to zero everything, the normal range is from 2.5 to 4.0. Anything above that, regardless of your age, you must go for diagnosis, proper diagnosis, to know whether the prostate gland has become benign prostatic hyperplasia, or there's an inflammation, or it has turned out to be prostate cancer. That having been said, what do we have in Ever Healthy Multidynamic International, an Indian Ayurvedic company that deals on Ayurvedic curative medicine? What do we have in store if we have a client or as a man who will use to attend to prostate issues, be it benign prostatic hyperplasia, be it inflammation of the prostate gland, be it prostate cancer? However, if the prostate cancer is at stage 4, what I tell you all to do is tell your client we are going to apply an aggressive medical approach. That's what we call medically an aggressive medical approach. That aggressive medical approach will also tell you it is 50-50 because the prostate cancer is in its advanced stage. It has crossed stage 1, it has crossed stage 2, it has crossed stage 3. If your prostate cancer is in stage 1, is in stage 2, is in stage 3, ladies and gentlemen, we are not going to apply an aggressive medical approach. We only apply an aggressive medical approach when it is in stage 4. So you can see on the screen what we recommend, what we give when there's prostate health issues. Number 1, you can see there our clean detox. The clean detox is EMD antioxidant, an antioxidant that detoxify you from the crown of your hair to the sole of your foot. Remember, these are not supplements. These are not organic medicines. These are not orthodox or conventional chemical drugs that have side effects. No, these are Indian Ayurvedic curative medicines. Indian Ayurvedic curative medicines, first of its kind. There's a very sharp difference between Ayurvedic curative medicines from the incredible India, supplements and organic medicines. They are not the same thing. Quite different from the one you already know, very popular all over the world, conventional or orthodox chemical drugs. All conventional or orthodox chemical drugs have side effects, from the least to the big. This Ever Healthy Multidynamic Ayurvedic curative medicines does not have any iota of side effects. Rather, it has 100% side benefits health-wise. Clean detox, like I was saying, you can see our antioxidant detoxifies. Yeah, it serves as antioxidant. Detoxifies you from the crown of your hair to the sole of your foot. We'll give it to you. When you take it, it will open up the channels, meridians, and collaterals of your body system from the crown of your head to the sole of your foot. That is what that clean detox does, so that when you're now taking the rest, there'll be no obstruction, there'll be no obstacle, there'll be no blockages. Remember when we talked about the signs and symptoms of prostate issues, we talked about blockage. So this clean detox will open up the channel collaterals of your urethra, your body system. The next you can see is the Iba juice. I've taught you all before now that Iba juice is meant for all health challenges. In fact, it works holistically. What is that health challenge? Iba juice must be there. I know this is first of its kind. Some of you will be learning firsthand this night that, oh, so you can give Iba juice to somebody that has prostate issue. The answer is yes, 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 because Iba juice works holistically for all forms of health challenges. That is why it's there. The next is Kabu 500. In India, it is called the tree of life. In India, Kabu 500 is called the tree of life. This is an Ayurvedic antibiotics, first of its kind. Doesn't have any iota of side effect. We also recommend it for any issue that has to do with prostate. The next is Pros-X, bearing the name prostate. You can see it. Pros, prostate means prostate. Anything that has to do with prostate. You can see the drawing there, the prostate gland, the walnut side. You can see there below the bladder. You can see there, that's the prostate. It must be there for any type of prostate issue or health issue. Then the next is Nutri-F. Please, ladies and gentlemen, when it is benign prostatic hyperplasia, Nutri-F will not be there. Nutri-F can only be there when it is prostate cancer. Don't get it twisted. When it is prostate cancer, Nutri-F must be there. But when it is enlargement, inflammation, Nutri-F won't be there. Remember, Nutri-F is very, very good for anything cancerous. So it is added there when the prostate has become cancerous. It has become malignant. But if it is benign, no. If it is inflammation or enlargement, no. But when it has become cancerous, prostate Nutri-F must be there. Don't get it twisted. Then finally, but not the least, FS Desire capsule. Yes. Remember I talked about another symptom. If you are a man, you're not getting this early morning erection. There's a problem. It takes care of that. FS Desire capsule. No iota of side effect. Unlike sex enhancing drugs that have loads of side effect. This doesn't have any. So these are what we give for a man that has prostate health issues. We discuss 3 types. Benign prostatic hyperplasia, BPH. 2, inflammation of the prostate gland. 3, prostate cancer. These are the EMD Ayurvedic curative medicine. Ladies and gentlemen, remember in our Zoom link, we said we are going to discuss 2 health issues. We've talked about prostate gland. Our East African EMD family partners. At this time, it is past 10. Is it possible that Dr. Britishman should still go ahead or proceed to discuss fibroid that is meant for the female folks? I want to hear you, audience, please. Hello? Hello?
Hello. Hello.
Am I being heard? I'm putting into consideration our East African EMD family members. By this time in Uganda and Kenya, it is past 10.
Yes.
Should I proceed with the fibroid health issue for the female folks?
Yes, proceed, please.
Proceed.
Sure.
I should proceed?
No.
Yes.
No. I'm calling from East Africa. No.
Good. Here, he said no, because it's past
Yes.
10 now there.
On behalf of the rest of East Africa, we kindly request if it can be done next Zoom meeting.
Good. I totally agree with you, Mama of Africa EMD. Next week, Saturday, Dr. Britishman will be featuring again to discuss what fibroid is, another health issue that affects the female folks. That is a nightmare to the female folks. So at this juncture, I want to hand over the mic to Mama of Africa EMD, Madam Gladys, so that I can be able to attend to health questions as Dr. Britishman is present. Thank you, ladies and gentlemen, for being present. Thank you for sparing your time to hear me out about this health issue that has been a nightmare to virtually all the male folks on this planet Earth, prostate. Thank you for coming once again.